For the record, could you state your name, please?
Morgan A. Larson, DPM.
And Dr. Larson, could you tell us what your occupation is?
I practice and teach podiatric medicine and surgery.
And are you board certified by any American board?
I'm certified by the American Board of Podiatric Surgery and the American Board of Primary Podiatric Medicine and Podiatric Orthopedics.
Have you served as a doctor who would review potential articles in the Journal of the American Podiatric Medical Association before they would be approved for publication?
Yes, I have.
Have you done it for any other journals too?
For the Journal of Foot and Ankle Surgery.
Now, doctor, I noticed you have published in the podiatric field, and I counted up 3 chapters in different textbooks. Is that correct?
That's correct.
And then over the years, you've had many articles. I've counted from your CV 41 medical articles. Is that correct?
That's about right.
And do a couple of the articles deal with cancer of the foot?
Yes, they do.
And you have been invited many times to speak to medical groups of doctors and to lecture to doctors. Is that correct?
Yes, I have.
On your CV, I counted, instead of just going through them, approximately 70 different medical association meetings. You've been invited to present and to lecture to the doctors throughout the United States. Does that sound about right?
That could be, yes.
Now, in this case, have I asked you to review the care and treatment that was provided by Dr. Edward Murphy to Mr. Mark Johnson?
Yes, you have.
Did I ask you to determine, in your opinion, the care provided by Dr. Edward Murphy met the standard of care required of a podiatrist in treating Mr. Johnson?
Yes, you did.
And what is your understanding of standard of care?
Standard of care is that knowledge and care expected of a reasonably well-qualified podiatrist in a setting similar to other qualified podiatrists in similar circumstances.
And over the years, have you ever encountered melanoma of the foot?
Yes, I have.
How many times?
Approximately half a dozen times.
Now, in this case, we're dealing with a particular type of melanoma, toenail. Have you encountered in your over 30 years any patients with subungual melanoma?
Yes, I have.
How many?
Probably 2 that come to mind.
Is subungual melanoma a very rare finding?
Yes, it is.
Now, I provided you with certain materials and depositions to review. Is that correct?
Yes, you did.
What is your understanding of the care and treatment that was provided by Dr. Murphy?
Dr. Murphy saw the patient with an infection of his 4th toe. He performed an incision and drainage. He took cultures, x-rays, and prescribed antibiotics, and then followed up approximately a week later, observing improvement in the condition after treatment for infection.
Now, a blackened spot, what can be the cause of that?
Injury, infection, gangrene, melanoma.
Now, in a case like this, where a patient presents with a black spot on their foot and it's suspicious looking, what comes to your mind?
Well, it depends on the circumstances, what the history is, what the patient's complaints might be. A painless black spot could be any one of a variety of significant or insignificant pigmented lesions. It could be a nevus, could be a melanoma, it could just be a freckle. It depends again on the whole context in which this condition is evaluated.
When you say the context, does a doctor have to evaluate a patient in a particular context?
Each patient presents individually with their own set of circumstances, so they each have to be reviewed as an individual case. You really can't generalize from person to person.
If a patient like Mr. Johnson comes in and says he has a sore, ugly toe, what does that tell you?
Tells me there was injury or infection.
If there is an abscess on the toe, what does that mean?
Abscess means an infection that has disrupted whatever tissue it arises from. There's usually a pocket of pus that is an indication of bacteria thriving in that environment.
If there is redness around the toe, along with the pus, and the patient had said it's sore, what does that tell you?
That strikes me again as infection or injury.
If there's swelling on top of all that in that context, what does that add to your context?
It increases the suspicion for infection.
And if the patient tells you that he had been treated for an infection on amoxicillin and had had improvement on that, what again, in the context, does that tell you?
It tells me that there's likely infection that has not been adequately drained at this point because antibiotics weren't resolving it. But they were improving at least.
And you understood that previously the patient only had antibiotics.
That was my understanding, yes.
So, Dr. Murphy added the incision and drainage. Is that your understanding?
Yes.
Did Dr. Murphy take a culture and send it to a laboratory?
Yes, he did.
And did the laboratory results confirm that the patient had an infection?
Yes, they did.
And did the laboratory also tell what antibiotic would be appropriate for that infection?
Yes.
Now, is it your understanding that Dr. Murphy put the patient on the antibiotic before the culture and sensitivity report came sometime later?
He did, with an empiric antibiotic, which essentially means it's the clinician's best guess of what might help the infection pending the results of the culture.
In this case, when the culture sensitivity report came back, had Dr. Murphy given an appropriate antibiotic?
Yes.
And a week later, when the patient came back, what did the patient report?
That he was improving. His exam indicated there was less erythema, as his note put it, or less redness. So it was responding to the incision and drainage and the antibiotics.
Now, doctor, in view of the patient's history and the physical exam that was performed by Dr. Murphy and the patient's improvements with the antibiotics and the culture and sensitivity report confirming the infection, was there any reason for Dr. Murphy to suspect a melanoma in Mr. Johnson's toe on October 3rd or October 10th?
Not at that point in time, no.
Did the standard of care, given those situations and in that context, require Dr. Murphy to include malignant melanoma in a differential diagnosis on either of those days?
No. That would have been a real stretch.
Did the standard of care require that a biopsy be performed by Dr. Murphy on either of those days?
No.
And doctor, based upon your training and experience of over 30 years as a professor of podiatry, did Dr. Murphy meet the standard of care required of him in treating Mr. Johnson?
I believe he did.